My name is Dr. Peter Schnatz. I'm the Residency Program Director and Associate Chairman in the Department of OBGYN, Reading Hospital Tower Health. Our Department of OBGYN has a long history of education, even before our department was combined as the Department of Obstetrics and Gynecology. Since back in the 1940s, we have had a OBGYN residency training program. We get residents applying to the Reading Hospital from all over the country, and when surveyed, most of them have heard about us by word of mouth through their clerkship directors, their program directors, because of the outstanding reputation that we've developed. We have CREOG scores in the top quartile. We have currently 100% board pass rate. We have residents publishing and presenting their research at national meetings and opportunities to network with experts in the field around the country. And that's helped to just grow the reputation not only locally and regionally, but nationally. It may be surprising to some applicants or residents the size of this place, how vastly huge not only the Reading Hospital, but now Tower Health is. Because of that, there's a huge opportunity for clinical experience, for volume, for surgeries, for deliveries. So one of the beauties of the Reading program is that almost everything is done right here under one roof. All the care, all the surgeries, all the deliveries, our residents are part of everything that goes on here, that takes place here. So each day is obviously very different. Our residents have a night float system, so there are periods of time where they're on for a series of nights, but that allows their other rotations to be uninhibited by call and more flexibility in their workday. We abide very closely with the 80-hour work week. In fact, on average, our residents work 60 hours a week or less. It also helps provide for a good balance of hard work, dedication, professionalism with family and life. The cost of living is low. It's a great place to live, wonderful to raise a family. We have a culture here at the Reading Hospital that is collegial, family-friendly. It's an atmosphere where people come and they never seem to leave. Residents form mentor-mentee relationships with faculty and private attendings naturally and many times with many faculty. And those relationships go far beyond just teaching in the operating room or teaching in the delivery suite. They're life relationships that often last for years, and it's a beautiful thing. There are outstanding research opportunities. We have a very robust research division with statistical support, opportunities for grants, the ability to network with local research collaborations through Johns Hopkins, through Drexel, through Jefferson, through many collaborations that we're a part of, and of course now as a system. So we have clinical volumes that are second to none that help our residents to become top-notch in their clinical skills and procedural competencies. Our residents are in the 90th percentile or above in almost every surgical procedure across the board. In fact, for vaginal hysterectomy last year, we were in the 97th percentile nationally, and that's a procedure that many programs or many parts of the country is becoming a rare procedure, but yet it's a procedure that sets us apart as gynecologic surgeons. I'm not sure that there's another program that I'm aware of where there's the same depth and breadth of technological opportunities and clinical surgical technology that we have here. When you think of our state-of-the-art surgical tower, multiple robotic surgical platforms, the early FLS training. As interns, you will be trained in FLS within the first couple weeks of being here, and you'll be signed off and certified by the end of your first year. That's going to prepare you to be competent, confident, going into your busy years of surgical training, ready to gain all the experience that you need to take to the patients that you take care of for years to come. The Reading Hospital is a perfect balance of academia and clinical experience that's going to prepare you to go in any direction you want, whether it's private practice, academia, fellowship training. And my commitment to my residents is to stand behind you, to help you achieve what your career goals are.